Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then there are selective COX-2 inhibitors. These selective COX-2 inhibitors, these are also banned due to the adverse effects. These selective COX-2 inhibitors have cardiovascular side effects, especially for rofecoxib. Rofecoxib has cardiovascular side effects. The other selective COX-2 inhibitors are lumiracoxib, celecoxib, valdecoxib, rofecoxib, and etoricoxib. So this celecoxib is the least selective. It is the least selective COX-2 inhibitors, whereas etoricoxib can monitor the liver function. And this etoricoxib is the most selective COX-2 inhibitors. Now these COX-2 inhibitors are newer NSAIDs with less likelihood. These COX-2 inhibitors have less likelihood of GI side effects. They have less chances of GI side effects like dyspepsia, peptic ulcer and heartburns. But the problem here is the safety issue, because these COX-2 inhibitors will block COX-2 almost 1,000 times more than COX-1. So they will increase the platelet activation. Because they increases the platelet activation, this results in clotting. So because there will be clotting, so drugs like rafecoxib has increased the risk of thromboembolic side effects, especially thromboembolic cerebrovascular diseases are seen with the help of this rafecoxib, and this rafecoxib will result in stroke. So it is banned because it can cause stroke in elderly and stroke in even young. So it is banned. Rafecoxib is banned. Then we have valdecoxib. Even valdecoxib is responsible for thromboembolic events, and it is also responsible for allergic events. So even valdecoxib is blocked. So valdecoxib and rafecoxib are banned, whereas the drugs like etoricoxib and parecoxib and lumiracoxib, these are actually still marketed, but they have a black box warning because of the side effects.
thank you and thank you for watching.